Welcome back. A lot of measures have been set in place by the national government in collaboration with the Ministry of Health, of course, to curb COVID-19. But the question has been, are the measures being implemented in the community level? Tonight we have community leader Peter Ndereva from the Ruiru sub-county, of course, to give us an insight on whether the community are adhering to the measures put in place by the government, given that the cases continue to increase by the day. Welcome, Mr. Ndereva on set.
Thank you.
All right. We want to talk about what the community are doing to, of course, curb COVID-19 and the potential spread of COVID-19. What are some of the interventions or the measures the community has put in place in curbing the deadly virus?
Okay, thank you. Actually, as a community leader, I'm much aware that Ruiru sub-county is an area that actually is affected by COVID-19. And I'm also aware that this one is becoming serious as we proceed on. However, we have a good thing that the people are able to make sure that they are able to follow the guidelines that they are given by the government, because in many places they have put up areas where people are washing their hands, and they are able to adhere to washing of hands using the water that is provided and the soap. And although the government is saying that they use the water that is actually flowing, they have tried to put tanks which are providing temporary flowing water.
All right.
That is one of the measures. People are also adhering to the wearing of masks. People have actually developed a culture of moving out of your house with a mask, so that you may not infect or be infected by the others. I have also seen people adhering to the guidelines that they are guided, that you are supposed to stay far away from the other person, whereby they are keeping a social distance that they are supposed to keep of up to 2 meters, 1.5 meter or 2 meters, so that at least you may not actually get the chance of being infected by COVID-19 virus.
All right. Yes. But this is a new normal.
Yes.
The community are not used to some of these measures, like wearing of mask and the washing your hands every now and then. Are we seeing them now getting into the new normal? Are they now embracing the new normal?
Thank you. According to what I've observed, I think the people are trying to adhere to the guidelines, because although at the beginning it was hard, but I think they are trying to come into terms, because nobody wants to be affected or to be infected with the COVID-19 virus, noting that it is becoming a threat even to the lives of each and every person. So many, according to me, have tried to develop a culture of isolating themselves, even when they are traveling or when they are walking on the road. Others are also, even those who are not used in washing hands, some have developed a culture of even observing cleanliness, which they didn't before. So I think, to me, they are trying to follow up, and they are trying to do their best so that the effects may not be upon them much.
All right. According to the Ministry of Health, is that at this phase in our country, we are having local transmission or the community transmission, so to speak. But the numbers are continuing to increase, even as people embrace the new culture. Perhaps in your community, what are some of the stringent measures you've put in place to ensure that they do follow the directives? Because you cannot be following directives and the numbers continue to increase. It means there must be a gap somewhere. What are some of the stringent measures that the county government has put in place to ensure that people follow the directives given?
Actually, as you know, people may not follow, or they are not able to follow the guidelines without some enforcement. We have seen the county and the national government trying to enforce and trying to peacefully make people come to realize that this is a serious matter. They have been enforcing when they find people without masks. They have been enforcing when they find people in the marketplaces, to tell them that they should wear masks and distance themselves. And I think that one has been assisting. However, according to the rise of these numbers, we have also to go an extra mile to be more disciplined than that. Because if we are not disciplined more than the way we are now, there will be no flattening of the curve, as we are saying. It will increase so long as we are not adhering to the guidelines that we are guided by the Ministry of Health. So it is important for all the residents to make sure they take a personal responsibility, a personal initiative, whereby you know others are affected by the virus. You are the one who is not affected. You distance yourself. That is, you practice the social distancing of 1.5 meters or 2 meters. And then you make a culture of washing hands and sanitizing yourself, even as you board a matatu or as you visit after visiting a public entity, so that you may safeguard yourself. So I think it will be important for us to be more disciplined than before, so that the numbers may not rise. Yes.
Let us now look at the healthcare system. What are some of the, has the rural sub-county, of course, created an awareness in case you see someone with COVID-19 symptoms? And not only that, we're having women who are expectant during this particular time of COVID-19, and we have measures such as curfew and cessation of movement. Do we have a rapid response team to help women who may get into labor during the curfew periods, or people who might be in an emergency situation during this particular period? Do we have such kind of rapid response team in terms of healthcare system? Okay,
thank you. I think right now, because of the impact of the, or the projected impact of the COVID-19 pandemic, I think most of the emphasis has been put on the disease. However, if there are emergencies that are there, we are encouraging people, or the people are encouraged to visit the health center, because at the end of the day, that one can be a threat to life. However, right now, the response team that is there is for responding to cases that are positive, that are suspected to be positive. And they are especially at the sub-county, I'm aware, they have a very well organized rapid response team that is similar to the ones at the national level, which is actually officiated and chaired by the NDCC and the sub-county administrator as the co-chair. And they have a very well-structured system whereby they are tracking those who are affected by the COVID-19. However, that one may not effectively address the issue of other emergencies, but when a pregnant mother actually has an issue, I think he sometimes is allowed to go to the hospital. I don't think the mother can be restrained, even if it is past the hours that are necessary. The committee actually can allow such to go to the hospital.
But you see, even as you say that they are not really being restrained to go to the hospital, we have had cases in Mombasa where people are dying at home because maybe they are not taken to hospital on time, or they do not know how to respond fast. In rural sub-county, if a woman is expectant to a point that he cannot have a vehicle to rush him to hospital, can they be able to have a toll number to call an ambulance? Or if somebody has a heart attack or is ailing from diabetes and there's an emergency, do they have a toll number, or can they reach to an ambulance to help them during such dire times?
Actually, even before the COVID-19, those people who are in NHIF, they are usually encouraged to use a certain number, which I may give you before we end this interview. And there is no time that you can call an ambulance, especially the sub-county ambulance. I know there are county ambulances, and you find that there is none, unless if you don't reach them. But there is an ambulance that you can call. However, it's only that now the emphasis are on COVID-19, but the ambulances are there.
All right.
Yeah, actually, the other hospitals, like previous hospitals that I'm also aware, they are also assisting in the control of COVID-19, like Prince View here, which is just here as you enter Ruiru. I am aware they have an ambulance, and I'm aware also if an expectant mother calls them, he is taken for free so long as she has the NHIF card. And I think that one is good because they have engaged to bring that to give that service, because they know pregnant mothers may suffer during this scourge of COVID-19. So there are efforts to make sure that in as much as we fight this COVID-19, even some of the other diseases are actually attended. However, we may not say that people are willing to go to the hospital as such, because they think that now they are not supposed to go. Like as you have said in Mombasa, I think people have not come into terms that they can have other complications apart from COVID-19. I think some are also fearing that when they go, they will be taken to as if quarantine, as if they have the COVID-19. I think people should not fear to visit a health center, because at the end of the day, you will be assisted at the hospital. Yes.
All right, let us now look at the support that you're getting at this particular time. Do we have some community-based organization and the non-governmental organization coming in place to help? Should the county government not do enough to help the community at this particular point?
Okay. Concerning the CBOs, I think there are some very organized groups which have been giving, apart from the government now, because government has got a system. And if I can say, I'm aware that the government have got a logistic team at the county level, which is chaired by the governor and the county commissioner, which has trickled down to the DCC and the sub-county administrator. And I'm aware they have a system whereby they are organizing to give food and other essentials like sanitizers and masks. I'm also aware that the governor, Bwana Nyoro, has been giving food maybe in all the wards. Although I would also say and tell the community that if they have not received, they will receive, because I'm aware and I'm sure they will receive. So there is that. But on the ground, there are some initiatives. Like I am aware in Githurai there has been an initiative called Bright Future, which is actually doing a very good job in mobilizing one hunger, one person. And they are giving food for the few people who are hungry. And it is doing well. There is also another group called Team Gatongola, which has been fundraising and giving food. And they are doing well. And I cannot also fail to say that there is another team, rescue team, which has also been doing the same and trying to give to people guideline on washing hands and giving food, because they are organized by young people. They have been creating a lot of impact on the ground level.
All right. Now, but we cannot escape from the fact that there are some challenges that are in the community level when it comes to fighting COVID-19 in terms of access to water, looking at the vulnerable group, whether they're getting the support at this particular time, because most of the people have lost their jobs due to the effects of COVID-19. Are there some of the challenges you're facing at this particular point that you could point out?
Yes, actually, there are challenges because people have not been well satisfied during this period. As you are aware, I cannot fail to say that COVID-19 is a challenge to everybody. I think to a certain level, even the president must be a bit overwhelmed, because he doesn't have the answers on his hand, although he's trying to do what he can. However, you find that there are some people who have not even been well provided for by being given masks and sanitizers, but I'm aware there are some systems which are actually organizing for them. Like I'm aware the county government has been started making sanitizers, and the county government has also been manufacturing masks, face masks, right now in some polytechnics that they own. So there is a shortage of masks. There is also a shortage of the sanitizers, and I think they are not well provided for, but I think the government is trying to do the same, plus the other stakeholders who are also trying to provide. However, there is also another challenge. As you may be aware, there are some people who lost their jobs because of this scourge. I, being a person who actually talks with the people on the ground, I'm aware there are people who need even a lot of, who need food more than anything else. Mm-hmm. And when you hear somebody saying that he needs food or she needs food and she has been well, you know that there is a problem. I think I should also say that it is important for all the stakeholders who are controlling or who are actually making sure that they suppress this COVID-19 to make sure that the part of feeding is well looked at. Allow me to praise the health guideline on diet and nutrition that was given the other day. I think that guideline should be well followed, because I looked at it and saw that it is guiding people towards nutrition and good health, which actually will make people to have more immunity. And when they have more immunity, they will be able to be strong and combat the germ to a certain level. Because as we are aware, when the immunity of a person is high, we have seen that these viruses may not be able to overcome you. So I think emphasis should also be made and should also be looked at by good nutrition, which will go a long way in making sure that the cases of deaths are reduced. Yes, but I think going forward, as the government is going to give food, I think it will address some of the challenges.
All right. There are some of the people who have complained in the community level, which I would love to know if it's the same in your case, where they're saying they'd rather not die of famine, they'd rather die of COVID-19 than not die of hunger or starvation. And they're saying that they cannot stay at home because most of them depend on the informal sector and therefore they are paid per day. Have you, of course, had some of those complaints?
There are some people even who have asked me for something for food. And I think there are people who are needy, who actually need some assistance. But as I've told you, I know the government has set up committees to look at some of those needy cases, and actually they have started distributing. That committee at the upper county, at our county, is chaired by the governor and the county commissioner, but at the sub-county level it's chaired by the DCC and the sub-county administrator. So they are looking at some of the needy cases, and I know they are addressing that issue. However, I cannot try to say that people should come up and support the team that is actually collecting the support, because food is needed in large amounts, because almost many families are very needy right now. Even them that were not needy before the COVID-19 actually pandemic comes. So there is a lot of there is that aspect of need for people to follow up and give those who are able to give, so that they can support the vulnerable. Because if they don't do that, hunger may even bring other effects, and the cases of death increases.
Right. But what are some of the measures you've put in place to identify the vulnerable members? Because we have had a case in one of the slums, Mukuru Kwajenga, where food was given to be distributed, but some of those vulnerable people have complained they did not receive food. To avoid the same mistakes being made, what are some of the things that you've done to ensure that you are able to identify the most vulnerable in the community and corruption does not come in and about those particular programs?
Okay, I think, I don't know whether that one was for the government or was for a CBU, but for the purpose of the government distribution, there is a set committee which includes, it's inclusive. The county administration and the national government are included, and there is also a disability membership is represented, and there is also a community and a religious leader who are in the team. So the chiefs and the community leaders together agree these are the families that need help. And when they finish that, they remit the list to the sub-county, which is adopted, and then the food is given unto them. That is a good system. And what actually may come, unless if people now scramble for it, but there are very good mechanisms for distributing. To an extent, the county is also giving or distributing food through individuals who are very needy. That is even taking the food to them at home. Because as you know, feeding is not supposed to make the people come together and then they spread the disease. They are supposed to be at a distance. So the committees are opting also to take the food to those who are needy instead of them coming together and be fed. Otherwise, that system is there, and I think it is working.
All right. So as we wind up, because you're pressed on time, can you tell us, as a community leader and having seen how this thing has unfolded for the 3 months, how the community has handled COVID-19, what do you think are some of the way forward and some of the intervention that should be put in place moving forward, given that this might be our new normal?
Okay, I think as a community leader and a councillor, allow me to say that the government needs to look ahead, because the COVID-19 may not go tomorrow. People need to do something. People need, first of all, to adhere and to follow strictly the government directions so that they may be safe. When you are safe and I'm safe, then we can do some activities for our economic progress. However, if people don't follow the government guidelines, it may not work. If people follow strictly, I know the government will allow people to do their jobs. And I want to also see that there is a time that the government will make people to go back to work so that the economy may not crumble and so that the country may go forward. However, that one also depends on how the results of the disease and the impact actually is seen. Because if there is no improvement in the control of COVID-19, then the government may not allow people to work and go about their businesses. But it is important because I'm aware the effect of lack of provision and nutrition and diet, as we are saying, if the effect is not well controlled, it can even bring deaths, which may overwhelm even those of COVID-19. So it is important as we go forward, feeding to be enhanced, and even as we control other effects of COVID-19. Allow me also to say that at a time like now, it's important for the people who have other complications to know that they are not supposed to keep quiet or stay at home. They're supposed to contact their the health centers allowed so that they can be able to be treated. And I believe the Ministry of Health will also emphasize on treating other complications, because they can also make the people weak, even to be attacked or to be affected by, or the effect to be more by COVID-19. So I think as we proceed on, it is important to look and see that other economic activities actually which are able to be taken or to be undertaken are carried on, so that the country can go back to normal as we live with the virus. Because as we are now, it seems that the virus may be with us for a long time. Yes.
All right. Thank you so much, Mr. Peter Ndereba, for making time. That has been Mr. Peter Ndereba, of course, giving the insight on what is happening at the community level. Of course, for the flattening of the curve in terms of COVID-19, it takes you and me. I don't mean to be a prophet of doom, but it seems COVID-19 is now our new normals, and we have to look into issues and the measures of containing the disease and living with COVID-19 as it is. We are taking a short break, but once we return, we'll be returning with more from the international news. Stay with us.